Hi everyone, thanks for joining us today. We'll just give a few more minutes for more people streaming in. Hi everyone who's just joined us. I think we'll give maybe 2 more minutes for more people streaming in. Thanks for being on time. Okay, maybe we'll just begin first. Thanks everyone for taking time to join us today for our February seminar. And today we wanted to start off with something different, just a little poll. So let me stop my share. And yeah, we wanted to involve our audience a little bit more. So here's a poll to begin. And you can vote. Your vote is anonymous. We would like to see what your thoughts are on this. Okay, about 70% of people have voted already. We still have a few more voting. The results of the poll. Okay. So I'll share results. Can everyone see this? Oh, only in the Zoom room. I guess if you are logged in on Facebook, you might not be able to see this. But yeah, it seems that most people, 58%, said definitely yes to if there was a trial in Singapore, which gives a one-time financial assistance of 5,400 to people who are homeless to uplift them. 38% are unsure, and 5% definitely no. Okay, well, there'll be another poll at the end of today's talk. So maybe after listening to our speaker, Dr. Jiaying Zhao, maybe some people have different opinions. But yeah, I will pass my time to Dr. Ong Tien, who is our moderator for today. She's also Deputy Director of SSR, and her specialization is in behavioral and applied economics. So she she's well suited to be our moderator for today. We will have a Q&A session at the end. So I've put the link to the Pigeonhole, so you may submit your questions there. So Dr. Ong Tien.
Hi, everyone. I'm very pleased to see the poll results. It seems like maybe the discussion will be unnecessary. People are already convinced before we even started. But of course, for the 38%, we'll try to convince you that, maybe it's worth a try. $5,400. How did we come up with this number? Is our median ComCare assistance for 1 year. So the median ComCare assistance as reported in 2019 is $450. So if you use that number times 12 months and you get $5,400. Okay, then we'll explain why this number makes sense. Before we start, let me just give a quick, before I introduce our speaker, let's just have a quick overview of what is the state of homelessness in Singapore. So thanks to Dr. Ng Kok Ho, I hope he's in the audience. We did our first homeless count in Singapore in 2019, and we found 1,000 homeless people. So what happens is that homelessness was found to be often chronic, and poor health and nutrition were very prevalent. Okay, the reasons for homelessness are unemployment or irregular work and low wages, followed by housing-related problems. So this is the context that I would like you to have in mind before we start the conversation. Well, this is the first time SSR seminar we have invited foreign. Excuse me. So it's the first time that we are doing a Zoom seminar with a foreign speaker who is presently not in Singapore. Okay, so and I guess that's the nice thing about the COVID situation. It allows us to be more globally connected. So I'm very pleased to introduce to you our speaker today, Professor Jiaying Zhao, who is the Canada Research Chair in Behavioral Sustainability and an associate professor in the Department of Psychology and the Institute for Resources, Environment and Sustainability at UBC. Professor Zhao is also one of the early researchers who found evidence that poverty may cause a decline in cognitive functioning, explaining why the poor may make counterproductive decisions. Okay, so this is very groundbreaking work. Today, she is also here with us. She's here with us to share more groundbreaking findings from her work in the New Leaf project, which involves a very generous unconditional cash transfer to the homeless people in Vancouver. Well, this kind of project is one of its kind worldwide. So we are very, very fortunate to have her with us today to share with us the findings. So, Jiaying, please.
Thank you, Jian, for inviting me. And hi, everyone. It's great to see you all. I'm excited to share my work with you today. This work is currently in progress, so we are writing up the paper at this point. So any feedback on the manuscript on the work is very welcome. So let me talk about the trial we ran in Vancouver, where we distributed a one-time cash transfer to individuals experiencing homelessness. Before I start, I want to thank my team, which is my PhD student Ryan Dwyer and Claire Williams, who's CEO and co-founder of Foundations for Social Change. It's a charity organization based in based in Vancouver that we started. as well as a team of interviewers and advisors. So in Canada, I was actually shocked to see the 1,000 people number in Singapore. It's a much more devastating situation in Canada. So on any given night, 35,000 people experience homelessness. This is a result of evictions, job loss, domestic violence, mental health issues, and addictions. In a given year, over 200,000 individuals experience homelessness. This puts a tremendous cost on the government. So any given person can cost between 55,000 to 132,000 per person per year to provide shelter services, social services, healthcare, justice services. And about 3 million households, that's about 24% of the population in Canada, are precariously housed. They're literally a few paychecks away from being homeless. And 1 in 5 households in Canada spend more than half of their income on rent. So these are the population that could become homeless anytime, and that certainly have become homeless under the COVID-19 pandemic. The situation is equally worse in the US. The numbers are much larger, given the bigger population base. Over 500,000 people are homeless on a given night. Over 100,000, close to 200,000 children are homeless on a given night. 2 million people use emergency shelters a year. Again, that costs a lot of money to the government. And about 6.7 million people spend more than half of their income on rent. So this is the grim situation of homelessness in Canada and US. There are many causes or costs of poverty, not just the economic costs. So as Jia mentioned, my earlier work showed cognitive impairments under poverty, and that poverty can causally elicit a range of counterproductive behaviors that can perpetuate poverty. So that's the vicious cycle that people can't get out of, with a psychological poverty trap. Poverty also causes significant stress and negative affect, which can lead to myopic decision-making and choices and risk aversion. These are the psychological barriers to escaping poverty. So under this year and the previous year, the risks of homelessness have been exacerbated by the pandemic. There's a higher risk of infection, first of all, due to the lack of safe housing and social distancing. There's a higher risk of severe cases of COVID-19, given the high prevalence of pre-existing health conditions. And there's a higher risk of other harms, for instance, unsafe substance use and domestic violence and among other risks, due to the closure of regular services that these individuals would normally be able to access. So one way to kind of fight poverty or to reduce homelessness, or I guess, let's say just fight poverty globally, is to use cash transfers, and specifically unconditional cash transfers. So this approach has been shown to improve psychological well-being, health conditions, financial management strategies, investment behaviors, food securities, and educational and employment outcomes in mostly developing countries. So there's a review done by the World Bank of 30 studies on cash transfers that shows a slight reduction on temptation goods after the cash transfer. So these goods include alcohol, tobacco, and gambling in developing countries. So that's a very promising sign of the cash transfer. But by and large, these studies have focused on low-income villagers or farmers in developing countries, and not typically homeless individuals. And these are the major limitations of cash transfer studies in the past. So first of all, most studies are done in developing countries with low-income individuals, as I mentioned earlier. Sometimes there's a lack of control groups, so it's not strictly a randomized control trial. There was no random assignment, so you can't really draw causality from those data. The amounts are different, given some amounts are small, again, PPP, within that given context. And the outcome measures are limited as well. So this motivated us to do the first trial with cash transfers to individuals experiencing homelessness in developed nations. So we focused on Vancouver, Canada. And we asked, what's the impact of this one-time unconditional cash transfer on recently homeless individuals? So this is the preface. It's people who are recently homeless, not chronically homeless. So specifically, we gave 7,500 Canadian dollars. That's about $7,500 Singapore, I think Singapore dollars, to each of the 50 recently homeless individuals in Vancouver as a one-time unconditional cash grant, with 65 recently homeless individuals as controls. And the reason we chose $7,500 was that it was the annual social assistance rate in British Columbia back in 2016 when we were designing the trial. This year, so in 2021, the income assistance is $700 per month. So the rates have gone up. And so if we were to replicate, we're going to increase the cash transfer amount. And the idea behind this cash transfer approach is that this would provide greater financial freedom to empower people to exercise control and choice over their life, to propel themselves to move forward, move beyond homelessness. And we track life outcomes for these participants over 1 year at these different time points after the cash transfer. And the study is pre-registered on Open Science Framework. At this point, it's under embargo, but if you want to see our pre-registration, I'm happy to send you a copy. So I ran this trial with a nonprofit organization called the New Leaf Project. Now it's called Foundations for Social Change. It was founded in 2015 in Vancouver. I became the principal investigator on the project in 2016 when we were designing the trial. And our mission is to empower individuals to move beyond homelessness and improve the quality of their lives. We recognize that being homeless is a circumstance, not a character defect. And our motto is to believe in someone. So this cash transfer ultimately is a gesture of trust. We trust that you can spend it well. And to do this, we teamed up with the ministry in British Columbia. So this ministry gave us basically a policy permission to run this trial where our participants can keep the cash transfer while still being eligible for income assistance. Because in BC, the policy is that if you have anything over $2,000 cash in your bank account, you disqualify for cash assistance or income assistance right away. So this policy permission is really important. Actually, we have this agreement with the BC province still at this point, and it's ongoing. So participants can keep the cash transfer while still accessing all the benefits they're eligible for. Another important partner for us is Van City, which is a local credit union in Vancouver. They gave us free checking accounts for all of our participants. So what we did was we opened a checking account for participants who are enrolled in this study, and we e-transferred the $7,500 into their checking account. So that's how we did the cash transfer. So in addition, we teamed up with 4 shelter organizations in the greater Vancouver area, so these are 22 shelters that are spread out across lower mainland, which is the greater Vancouver area, where our interviewers would go into each shelter in person and recruit participants or screen participants on our surveys. This was done, this started in 2018 and we wrapped it up in 2020. So in each location, we have a branch of Van City where we open up the checking account for our participants. Okay, so we do have a number of screening criteria. Not everybody who's homeless will qualify for our study. So first of all, we got referrals from shelters based on these 3 criteria. You have to be, between 19 and 65 years old. You have to be homeless for less than 2 years, and you have to be a Canadian citizen or a permanent resident. And then on top of that, we also screened participants on their substance use using DAST, which is the Drug Abuse Screening Test. And using this test, we screened in 55% of the participants. So we basically had a cutoff threshold for severity on this measure. We also screen people on alcohol use using AUDIT, which is the Alcohol Use Disorders Identification Test. So using this measure, 87 participants were screened in to our study. We also screened participants on their psychiatric symptoms. So this is using CSI, the Colorado Symptom Index, and 74% of these participants screened in. So take the conjunctive measure. I just want to show quickly that 31% of everyone we screened passed all criteria and were successfully enrolled into the study. So 31% is the conjunction of all these criteria. As a result, so 115 participants completed the baseline survey. That's our final sample size. I should mention that when we did the screening survey, there was no mention of cash transfer. We went with a cover story of the UBC well-being study. We basically asked people about their experiences in the shelter, and we asked them, all these questions without a mention of cash transfers. So at this point, none of the participants was aware of the cash transfers. And this is important because we want to ensure the honesty in their responses. Okay, so this is the RCT design. We have two conditions, the cash groups where each person received the cash transfer. In addition, these participants also received a 1-hour workshop with us for about every 3 months, where we talked about goal setting, plan making. We were doing self-affirmation exercises with them. So this is a kind of brief 1-hour intervention with our interviewers. We also provided some participants coaching. This is a life coach, which is not a counselor or a therapist. They simply were serving as a confidant for you to talk to about 3 times a week, 3 times a month for about 45 minutes each. So it's a phone call with our coach. And we have 2 other non-cash conditions. So one thing I should quickly mention is that there are no statistical differences between 1 and 2 or between 3 and 4. So this is why we collapsed 1 and 2 into the cash group and collapsed 3 and 4 into the non-cash group. I can get into the details between them, like 1 and 2 and 3 and 4 in later when we have time. But for now, I'm just gonna call them cash group versus non-cash group. In addition to this intervention, every participant in our study received an honorarium, $20 per hour for doing our studies. They got a resource booklet that provided all the local services that they can access. They got replacement, the ID replaced. They were also offered a used smartphone and Van City checking account. So these services were available to all participants in our study. Okay, so coaching. So quickly, we should go over coaching quickly because this question came up a lot. So one question we didn't even consider coaching was, think this didn't work, was the frequency dropped, after 3 months, which means our participants left the coaching relationship shortly after they got the cash transfer. So this is why I think coaching didn't work, and this is essentially a failed intervention on our part. And going forward, we won't be offering coaching as an intervention. Okay, so this is our sample for the cash group and control group at baseline, 1 month, 3, 6, 9, and 12 months going forward. The attrition rate for both conditions is about 48% over 1 year. This is remarkable given that these people don't have a stable address. We gave them a phone, but a lot of them lost the phone, so we couldn't reach them. And they were highly mobile. They moved around a lot. But even with these constraints, we were able to keep half of our sample at 1 year. And the reasons for dropout were simply the vast majority were loss of contact. We can't reach them anymore. A fraction withdrew from the study saying they don't want to participate anymore. And then a few participants passed away. This is our demographics of our participants. So the average age is around 42 years old, about 58% male, 40% female. 34% of our participants have kids. 12% of our participants were Indigenous. The average length of homelessness is 6 months. About 24% didn't have an personal ID to start with, which is why we provided the ID replacement service. And about 28% of our participants had some form of employment. So, a third of our participants were working, roughly speaking. And these are the reasons for homelessness in our sample. So the vast majority of the most prominent reason was landlord issues, evictions. They couldn't pay rent. That's the number one issue. Financial constraints, that's the second, that's very relevant to the eviction concern. Followed by family related, so it could be death, violence, conflict, etc. So you can see that substance use is actually a fraction, like it's a minority of our participants. It's 5% of our participants. Okay, so here are the results. We found promising results in these domains, which I'll go over. We are not seeing any difference in these domains. So this is incredibly encouraging. In fact, when I pre-registered the study, I was predicting, all these null effects to be significant. I did not expect any improvements in stable housing or employment. But so this is a positive surprise. But this also means that our pre-registration, our primary pre-registered analyses or results were not what we predicted. They did not turn out the way we predicted it. Okay, so this is housing, and here I'm showing you the percent of participants in each condition at each time point. B is baseline, and 1 to 12 months after the cash transfer. So what this graph shows here was at 1 month after the cash transfer, almost half of the cash recipients moved out of homelessness and into stable housing. Whereas at 1 month in the control group, it's only about a quarter of the participants. And over the course of 1 year, I think these cash recipients were able to remain in stable housing, which is very encouraging to see. And stable housing here, by that I mean their own home, their own apartment market rentals, modular housing, which is a social affordable housing provided by the city, supportive housing units. So these are all considered as stable housing. We quantified the percent of days that you were homeless at each time point between the two conditions. And cash recipients actually, they consistently moved out of homelessness or the shelter or on the street into stable housing at starting 1 month. And the control participants eventually caught up, especially after 9 months. So at 9 months after the cash transfer, the two groups became identical. But this is so important to see because on average, each cash recipient spent close to 3 months, fewer days, like 88 fewer days being on the street. I can't even imagine being homeless on the street for 1 day. And yet this cash transfer can save 3 months out of your life being on the street. And so that's an incredible saving. This is the percent of days in stable housing. So as I showed you earlier, at 1 month after the cash transfer, a lot of the cash recipients were able to move into stable housing quickly, whereas at 9 months, the control participants eventually caught up. And this is because in Vancouver, if you're homeless, you're put on a waiting list for about 6 months for supportive housing. And between 6 and 9 months, you eventually move into stable housing. So this is just a natural progression of being in the shelter in Vancouver. We tracked their spending. So this is their spending per month at each time point. So the cash recipient actually spent more money at 1 month and 3 months. That was great. We looked at their spending breakdown. This is what they spent, the money on. So a quarter of the money went to rent, a quarter went to food, some went to bills, transit, clothing, and only a fraction went to alcohol, drugs, and cigarettes. This is per month spending. So this is spending on durable goods. So these could be furniture, cars, anything that's kind of considered an investment. Computers, phones. So cash recipients spend more money at 1 and 3 months after the cash transfer, which is great to see. This is their spending on rent. So perhaps as a result of moving into stable housing, they increased their spending on rent. This is spending on food. They increased their spending on food. For these with children, so about a third of our participants have kids. So these parents or caretakers actually also increased their spending on food for their children. So this is a great positive spillover effect we see from the cash transfer. This is spending on clothing. At 1 month, the cash recipients were able to get a whole fresh set of new clothes, which is great. Likewise, for those with children, they increased their spending on clothes for their kids as well. And the last slide here is spending on temptation goods. So this includes alcohol, drugs, and cigarettes. There's actually no difference between the two conditions, and in fact, there's a reduction in this spending over time, whereas control participants fluctuated a lot over the year. And this is really encouraging to see. There's actually no increase in spending on temptation goods for the cash recipients. Now let's look at savings. In addition to spending, so cash recipients were able to save most of the cash transfer at 1 month, which is great, and also retain more savings at 3 months as well. This is all good to see because this suggests that they did not spend the money at once. They were able to retain quite a bit of savings over time. We looked at their total value of assets. So this is everything you owned. Everything you own at this point was the value. So cash recipients had showed greater assets compared to control participants at 1 and 3 months. And perhaps as a result of greater spending on food, more cash recipients were able to achieve food security at 1 month after the cash transfer. This is now employment. So we asked participants, did you have any kind of job, part-time job, full-time job? So there's actually not a big difference between the two conditions on employment status or whether they have a job. However, if we looked at hours worked, like basically how many hours you work on a weekly basis. So first of all, cash recipients had a lower starting point. They started at the lower baseline level than non-cash participants. So at 1 month, there's the interaction became significant, and as well as at 12 months. So the cash recipients were able to work more hours, at least immediately after the cash transfer, and also over the longer period of time. This is pay per hour, how much you're getting paid per hour for both groups. So cash recipients increased their pay per hour up to 6 months, whereas control participants were mostly flat, but showed a slight increase, not a significant increase at the end. So at least there's some benefit on employment in terms of work hours and pay per hour for cash recipients. And this is psychological function. This is an executive function, which is basically our ability to override impulsive responses. This is measured by a Stroop task. And we did see an improvement, a significant improvement at 3 months for the cash recipients and not for the control participants. This is subjective well-being. This is a combination of their affect and life satisfaction. So cash recipients felt better about their life or exhibited better well-being, mental well-being at 1 month. But then later the two groups kind of, again became identical. So the effects were short-term. And here we calculated how much cost each participant had on the shelter system through their basically days in the shelter. So this is the cost based in Vancouver. And what we saw here was each cash recipient saved $8,172 over 1 year, more than the non-cash recipients overall. So this is on average per person saving per year. So if you subtract the $7,500, you still get a net savings of $600 or so per person per year, which is really great to see. This suggests that the cash transfer could be a cost-effective approach to reduce homelessness. Okay, now I'm going to just quickly go through a bunch of null effects. So here we're not seeing any kind of significant differences between the two groups, and the data are also noisy on these measures. This is perceived health. There's no difference between the two conditions. Self-efficacy, this is how confident that you're able to handle problems. Again, not a big difference between the two groups. Sense of empowerment. So this is one outcome that we pre-registered for because we thought the cash should increase your sense of empowerment. Not the case. It seems like just being in our study has some benefit on empowerment, and the cash transfer didn't really increase their sense of empowerment. Social connection, again, no significant differences and mostly flat for cash recipients. This is a fluid intelligence measured by the Raven's progressive matrices. Again, no significant differences over time. Okay, so here are some participant testimonies on the impact of $7,500 on their life. So we also conducted a bunch of qualitative interviews with participants over the 1 year period. And so we gathered some participant data here. So this participant said, it helped me out a lot. It's given me purpose in life and has given me hope. It's given me the financial resources for me to get what I need for my house. So this is, indication for spending on durable goods. Another participant said, the impact it had on my life was huge. I was able to do a lot of things I couldn't do before. It has changed my ability to make proper choices. So that speaks to the cognitive benefit piece. If I had not received the cash transfer, I wouldn't be able to move out. This meant moving out of the shelter. I wouldn't be able to get my car back on the road, none of that. Another participant said, it helped me solve a lot of issues. Now I have a place, I can focus on getting to school, getting that career, focus on my son, right? These are the most important things. So that speaks to all the kind of positive spillover effects the cash transfer had. We asked participants, so now the study is concluded, we're done with the data collection. We asked participants for their feedback on our program, on our intervention. So we asked participants a bunch of questions. So this one is, would you have preferred to receive the cash in a different way? So this means maybe instead of one time, it could be two installments or 4 installments or monthly installments. Would you have preferred to receive the cash in a different way? And 40% of our participants said yes. So this gives us some ideas of how to structure the cash transfer going forward. We also asked, would it have been helpful for you to have someone to help you manage the money you received? For instance, having a financial advisor or a trustee. So almost half of the participants said yes. So with this insight, we're gonna, going forward, we're gonna offer a financial advisor from the banks, the credit unions we work with to help participants manage money. We asked participants, did you tell anyone about the cash transfer you received? About 73% said yes. We said, did anyone else find out about the cash transfer, even though you didn't tell them directly? Only a fraction of them said yes. So they told their close family members, their friends, some caseworkers in the shelter. But in terms of just people finding out you got the cash, that was not, that only happened to 1 in 5 participants. Okay, and then we also asked, would you like to have met other participants in our project who received the same cash transfers as you did? And 40% said yes. So now this gave us some ideas of building some peer support group for our cash recipients. Maybe they can talk to each other about how to handle money, how to manage their money well. Okay, so some key takeaways. We're working with the most impoverished people in the most expensive cities in the world, like Vancouver, with the highest rents. A single 1-bedroom apartment in Vancouver is about $2,000 per month, which is crazy. We also have the lowest of vacancy rates in the city. But even so, cash transfers increased housing stability, spending, savings, assets, a range of positive outcomes from the trial, which is very encouraging to see. We did not see increase in temptation goods spending, which is also great. So cash transfers can be a cost-effective approach to reduce homelessness. This is from the cost-benefit analysis. So our policy recommendation is to distribute the $7,500 to individuals who recently became homeless without severe substance use, alcohol use, or psychiatric symptoms. But this is the difficult policy to implement. We talked to a bunch of provincial policymakers, government officials, including federal government officials in Canada. There's some reservations about implementing this policy. So it's just to get around to, get at why people are so hesitant. We did a few more surveys. So in this survey, we asked people, imagine a person just received a $7,500 cash transfer. Now, how much do you think the participant, the cash recipient, was spent on temptation goods, defined as alcohol, drugs, and cigarettes? So this is just straight up asking them, how well would the person manage the money on temptation goods? And critically, we basically frame this individual, this cash recipient, as someone who's homeless or who's not homeless. We frame this individual as someone else, or it's you. You became homeless, or you were not homeless. And this is, over 1,000 participants in Canada or US. And what we found was the following. It was actually quite shocking. It's basically, if it's someone else who's homeless, then people think that they're going to spend way more money, close to $500 per month. So not per month. Oh yes, per month on temptation goods. Than if someone who's not homeless, or if that someone is you. So we are very confident about ourselves. Like, we are not going to spend it on alcohol and drugs and cigarettes. But if someone else, yeah, they're going to do it. So there's a deep public mistrust with homeless individuals, especially in North America. We also asked them a different question. We said, all right, how much do you support a public policy that distributes a one-time unconditional cash transfer of $7,500 to people who are homeless? This is basically measuring public support for this policy, going from 1 to strongly opposed to 5 strongly support. And we framed so we framed this policy in slightly different ways. Control is simply just this question. We provided more information behind this policy. We said there's a trial done in Vancouver that found that these individuals after receiving the cash transfer reduced their spending on temptation goods and increased their spending on rent, food, and clothing. So basically a summary of our findings on spending. So this is what we call counter stereotype. This is against what people believe, what homeless people would do. Another condition we said in a trial, the cash recipients actually reduced their reliance on the shelter system. And as a result, this reduced reliance produced net savings for society. So this is a purely utilitarian argument for this policy. And what we found here was, if you provide examples of spending that are counter to people's stereotypes of homeless folks, or if you make the argument of cost savings for society, then they become more supportive of the policy compared to the control, which is zero information provided. Okay, and there's no difference between the counter stereotype and utilitarian. So these two are identical. Okay, so for this policy to come into effect, or to be actually passed, to be legislated, I think we will have to address the resistance from the public due to their mistrust in recipient spending on temptation goods. And the way to do that is we can increase public support by highlighting reduced spending on temptation goods, or highlighting the net benefit, net savings for society. Okay, so going forward, we are actively putting together a grant application at this point, where we're giving out, $8,500, which is the current income assistance rate in British Columbia and many provinces in Canada. This is the annual income assistance rate. So 2 conditions, cash versus non-cash, in addition to all the supports that we're going to provide to all participants. We're going to measure the 6 outcomes that I showed you earlier for at least 1 year. We're going to deploy this project in Vancouver, Toronto, and Halifax. So one thing you must have noticed about our pilot study was it was a small sample. We had 115 participants overall. It's a tiny sample size. So in this expansion project, we're going to expand that to in a total of 2,500 participants in 3 cities in Canada. So that's our grand plan going forward. And I just want to wrap up. I want to thank my team and all the funding sources. And thank you for the opportunity to share my work with you today.
Thank you, Jiaying. Okay, so this is a wonderful sharing. There are lots and lots of results. I'm sure people are trying to digest them. Maybe I could start the Q&A session with my first question. My guess is that a lot of people will be wondering right now, how do we make sense of the lack of sustained improvements in many of the areas? I mean, we understand a bit about housing, because you explained that eventually people who are in the shelter or are homeless will get social housing from the state. So that explains housing, but could you help the audience to understand, like, why are there lack of sustained improvements over time? And how do we convince ourselves that without these sustained improvements, the cash transfer is still considered a success?
Yeah, so maybe I'm going to go back to this slide. So this is kind of the lack of sustainability point on housing. So yeah, so I think that's a good point. I have to say that $7,500 in Vancouver is not that much. It's about, ordinarily it's about 3 months rent if you live in an ordinary apartment by yourself. In this case, I think spending on rent is about $500. So these are supportive housing units. It's still tiny compared to the living standards. It's not a livable wage by any means. So which is why I don't think $7,500 is a silver bullet to reduce homelessness for good. It would reduce homelessness fast, and that's what we saw. That's something that I did not expect. The impact was immediate. It was 1 month after.
Right.
And the, as I showed, even with this kind of the shorter time frame with the impacts, we still found 3 months fewer days, 88 fewer days, like it's almost like 3 months less on the street. And it has, meaningful implications for government, investment, right? So just trying to go to the cost savings slide. Here we go. So because of this reduction in shelter, in using the shelter system, this is the savings just through the shelter use alone, right? So I think this is really promising that by moving one person. Yeah.
Sorry, is this the savings per year?
So this 8,100 is per year per person.
Yeah, and the sustained effects were found for up to 6 months. So there was tremendous improvements in many areas up to 6 months, after which it kind of like tapers off. But it costs less to give the cash transfer for 6 months effects compared to a 1 year provision of shelter.
That's right.
That's how we interpret this, right? Yeah. Yeah.
So if anything, I would suggest that after 6 months, which is where our benefits dissipated, there should be maybe a second injection, maybe. But it may not be necessary because they remain in stable housing, right? It's not like they fall back, they fell back to the street, or
right.
So I do think that if you want to get the last 25%, this is almost like the last mile problem. You probably have to do something more than $7,500, right? So for these individuals, maybe the $7,500 is not sufficient. Maybe they need a second injection. So that would be my recommendation.
Do you have a sense that those who were in the cash transfer program, right, eventually moved into supportive housing after 9 months to save on rent? Like, I mean, the cash transfer just, is probably gone by the 6 months, right? Given the high rental costs in Vancouver. Yeah, did they move into social housing after that and sustain just like what the non-cash transfer people were doing?
So they did. So this is spending on rent, right? So after 6 months, it's almost like the rent is around $400,000, and then it stays there. This suggests that they're in supportive housing units.
Right.
Both of them here.
Right.
Right. So they stay there. Some were actually paid more rent because they were able to move into market housing. That's a fraction of, like, a small percentage of the participants. But yeah, so this suggests that they're not like moving out of the supportive housing units where they're moving to another housing units. Now, this is only 1 year. I don't know what the data will look like after 2 years. We do have some data at 2 years. It's a much smaller sample. And so far, from what I can tell, at 2 years, I don't have data here, but they're mostly kind of still at the same level as 1 year.
Right.
Yeah.
Okay. The other point that I think our Singapore audience would be very interested in is the impact on employment. Right. Some people would have caught that slide where, the ones in the cash transfer group did not have as high rate of employment as the non-cash transfer group at the end.
Yeah, so this is kind of, I mean, the cash group had a lower starting point, right? And yeah, so there's no, I mean, this is a kind of, to me, this is quite low overall for both groups.
Right.
And none of this is significant. Like none of these little spikes were significant.
Right.
So I wouldn't draw any conclusions. I mean, this is purely a null effect.
Right.
But so the data I showed you for the hours worked or pay per hour, I mean, that's for people who are working, who have jobs. But this is like the 25 or 30% people who have jobs. So, I mean, it's hard to, I think it does take time to get a job. Depends on the supply, depends on the skill set and whether they, they can find the right job. A lot of what happened with our participants is that they held like part-time jobs and then they quit, or they went on, then they didn't work for a while and then they went back to work. So they're episodically employed, not all time, like employed all the time. One reason is they have children, so a lot of let's say single mothers, they couldn't hold a job because of childcare.
Right.
So, I mean, there are many reasons why we don't see an impact on employment, but this is not to say that this approach would never work, right?
Yeah.
If I can, we're trying to run this again. I would argue that getting a job is not a problem and a cash can easily solve, because you need skills, you need to apply for jobs, right? Giving you cash is not necessarily going to get you a job. It probably will get you housing or food, but maybe not jobs. So I think for employment, there has to be a different solution.
Can we kind of like conclude that at the very minimal, we do not see evidence of reliance on the participants, the cash transfer participants or beneficiaries on the system? Because I mean, if they are completely reliant, then they should just go off employment, relax, take care of themselves, and just wait for another cash transfer to happen, maybe. Yeah. So can we kind of say that? Like, I mean, if we are not seeing sustained improvement, at least we are not seeing evidence of the other side, which is high rates of reliance, which the Singapore audience will be concerned about. Yeah.
Right. I mean, we don't see increased use of social services. We actually looked at hospital visits as well. There were very few cases in our participants. Sometimes like 1 or 2 cases. So that's a very, very good sign, right? It's not that they increased their reliance on social and health services, but yeah, I think at least for shelter system, their reliance was significantly reduced, and that's great. That means there's an extra bed for some other people, or eventually I hope the shelter systems will no longer be necessary. That can be turned into a more productive use of resources. Yeah.
Okay, so I get my share of questions as the moderator. So now we will look at the questions from the audience. Okay, so the one that has the highest votes. Okay, let me just quickly update this in case.
There's a question, there's a hand up from someone.
Yeah, okay. There were a few questions about eligibility. So people are concerned about why only the recently homeless are qualified for the cash transfer, and how do you think the results will be different for those who are chronically homeless?
Yeah, so we put in the recently homeless, which is less than 2 years, in place for the pilot project mostly because of the ethics board argument. UBC ethics board it took us 6 months to like get their approval, because they were so risk averse. They said, well, it's too risky, So we said, okay, how about just the recently homeless? They tend to be higher functioning, and then they eventually sign off on that. but I don't think the years of homelessness is the best indicator of your functionality. So going forward, we're going to remove this criterion altogether. We're not going to say you have to be recently homeless. We're just going to screen you on, substance use, alcohol use, and mental health symptoms. That's it. We're going to remove that years of homelessness criterion.
Right. Okay. So basically, the recommendation is that if we were to try something out in Singapore, it would be better to first try it on people who have who only have financial related kind of issues, not addiction or alcohol abuse, which may require other interventions. Yeah. Okay, and the second question is about the workshops and coaching, as you have correctly mentioned. Many people felt that coaching, workshops, hand-holding would be very important and would kind of interventions. So so how are the interventions chosen, and whether the attendance was compulsory?
Oh yeah, good question. The attendance was not compulsory. So the workshop was to at least get people to plan their spending, hopefully, right? So there's self-affirmation was designed to mitigate any doubts about themselves. We have goal setting and plan making exercises just to get them thinking how I would spend this cash. And so it wasn't required. Most people attended the first session, but they again, the follow-up rates were terrible. So we weren't able to get them back to the workshop later on, which is why, same with coaching, which is why these interactions kind of failed. But we designed it in the first place, hoping that they will help participants manage the money and manage their own safety as well. It's good lesson learned. We won't be doing that in the expansion project, but we will be, providing, let's say, not providing, encouraging people to talk to their peers, people who have received cash transfers. So that's another kind of maybe mini intervention we're thinking of.
Do you think that the coaching people didn't use the coaching service because they are connected to other social services, the social workers were helping them?
Yeah, they do have caseworkers, they have social workers, but the reason coaching failed so terribly was you can't force someone to be coached.
Right.
Coaching is such a voluntary action, and you can't say please talk to this coach. That's our ask, but you can't force someone to do it, right? And another reason was these life coaches were kind of coaching you on a higher needs, than more like self-actualization needs, as opposed to how do I do my resume? How do I apply for rent subsidy? How do I get my ID back? So these are the questions that our participants really want answers for, but the coaches are not at all. These are really for caseworkers, not for coaches. So that's also a mismatch between the skill sets from the coaches. So for many reasons, this is just the top two. And there are other reasons like phone, because the coaching happens over the phone and participants would lose their phone at some point. So you can't reach them. We can't even reach our participants. So the coaches couldn't, get in touch anymore.
Okay, so I guess that concludes the part about coaching. But I heard that you were going to have a financial advisor anyway, right, for the next trial that
they will be offered one from the bank, but again, it's voluntary. They don't have to use it. They don't have to use that service, right? So.
But from the looks of it, from the looks of their spending patterns, if they were spending on rent, food, children's clothing. So for $7,000, how much do we expect? How much more can we expect from them in terms of management of their money?
What they can do, I think some participants expressed that I would put maybe 4,000 into a savings account
Mm.
and only access 3,000 at this point. And then once I exhaust 3,000, I'm gonna dip into my savings. So that's something they
Right.
suggested. But I think, it's up. I mean, to them, $7,500 is a huge number, but it's not a huge number in Vancouver.
Right.
So I think eventually they realized, whoa, well, we kind of, by 9 months, they spend all $7,500, right? So in that case, I think either another cash injection would be useful, or I don't know. I think maybe at that point they should really consider getting a job or getting a higher paid job, to as an additional source of income.
Mm.
But unfortunately, that's not something we see in our data set, which is only up to 1 year. But I think, if we were to track them for longer, I do think that some participants will get jobs. We do hear from some participants, this is again a much smaller sample size, that they have gotten jobs. This is beyond 1 year.
Mm.
Yeah.
Okay. All right. Okay. There are technical questions as usual about small sample size. So maybe we should address that. So yeah, I mean, many people would be looking at this and say, okay, it looks great, but there are 50 people who got cash transfers. Can we trust the results?
Well, I would trust the 50 people. I trust the results from the 50 people and the 65 controls. What I don't trust is how generalizable are our results to other individuals experiencing homelessness, or other homeless communities in the rest of Canada, or in the world, right? So that generalizability piece is I'm unsure of. We don't have that data to speak to. But in terms of the confidence in the results I showed you, I'm pretty confident this is exactly what we found with this pilot. But yeah, we can't really say this will happen if we were to run this with larger sample or with in other cities, which is what we need to do next.
Next phase. Yeah. Okay. Yeah. So let's see what other questions. This is interesting. How did the project convince funders or partners to work with the project to provide cash grants? Well, this must be somebody who is having an idea.
Well, this is the funding side?
Yes, that's right.
Great question. So we got $500,000 from the federal government that kickstart the project, and then we fundraised over $1 million from private donation, so private foundations and donors in Canada, and it was fundraising probably was the easiest part in this pilot project. The most difficult part of the pilot project was the ethics board at UBC. And I think people have, at least philanthropists have the appetite for this kind of approach. And the government, especially the provincial government, is very much on board with this approach. So yeah, people are, very keen to see this approach being tried out in different cities.
Right.
I don't think we will have the same luck in the US, because it's not that there's no funding potential. There's actually bigger funding potential in the US, but the challenge is the policy restrictions. The state governments in the US are less willing to give you the permission. Like, it's literally like, asking them to change the policy
Right.
on a very short-term basis. That's much less likely to happen in the US than in Canada.
Did you manage to get to talk to the social services about how, because the beneficiaries were able to still apply for social assistance and continue the services with social services, so continue receiving social services. Do you get a sense of how this additional cash transfer affected the or change the relationships between them and their social service providers?
You mean who are the providers you're thinking of?
Well, like their caseworkers, you know.
Oh,
Yeah, some people will say that, the financial assistance is a way of engagement with their clients. And when the clients have have more resources, then they kind of just drift away from their caseworkers. So do you see that happening in BC? Any idea?
well, the guests, the shelter guests, were moved out of the housing, well, the shelter very quickly after the cash transfer. So, I mean, I think that's why I would say most of our cash recipients lost contact with their caseworkers right away, as soon as they left the shelter.
I see.
This also raises another question. Because they moved, they were no longer sort of involved or connected to their previous community. And that's why we see kind of this dip in social connection for it's not significant, but there's like a persistent dip in social connection for our cash recipients over 1 year. And we're wondering why that was. I think the reason was they moved, and then they were kind of they were no longer back on the street or in the same shelter or in a different shelter, right? So that's why they were no longer connected to the people that they knew before. One other reason was they were very careful in terms of who to tell, because if people find out you have this cash transfer and you live in a shelter, it's actually really dangerous. Because people can attack you, they can assault you, they can rob you, they can coerce you to get you to give them the money.
Right.
So in that case, I think our cash recipients almost chose to leave the community they know, but in a sense decrease their social connections, but they know that this is necessary to regain stability in their lives.
Right. Okay. So maybe following up on this, Jiaying, the moving to opportunity in the US, right? One of the most important outcomes that they have not, or insights that they have drawn, is that it's important to move people like to stable housing, but the neighborhoods that they move into are equally important. So do you have a sense of, like, with the $7,500, where did people move to, and was it a conducive environment for them?
Yeah, so most of our participants are still in Vancouver. They moved into modular housing, apartments with friends, so like regular roommate situation. These are supportive housing units. So that's where they have been staying. Some participants, I'm going to say probably less than 20 of our participants. I'm sorry, not 20. 20 total, so maybe less than 10 of our cash recipients moved out of the province. So the reason being, Vancouver is very expensive, so they moved into the Alberta or a different province that's a lot cheaper. So we did see kind of a few participants moving away, and when they moved, they usually stayed with a family member in that province. So yeah, so I think most of them are still in Vancouver in some kind of supportive housing units.
Okay, so then there is a related question to this, which is that, okay, so in Singapore, most of our, we have social housing, which are called rental housing. So those are usually, on the contract is for 2 years, but renewable. So people can stay there at a subsidized rent, with a subsidized rent. So some people are wondering, like, how would the cash transfer look like if we had given to people who have some sort of housing, like rental housing? So in your case, it would be like a phase 2 kind of funding, right? Injection of funding. So now that they have stable housing, or for those who have moved into stable housing, what do you think will happen given the experience of the first study when you give people the cash transfer, a large, generous cash transfer? Would that how would that help them?
Yeah, so these are people like still in housing, but are struggling financially, right?
Right.
Is that the population you have in mind?
Yes, that's right.
Yeah, so that's a great question. I think people who have more money will do that, like, because these are people still living below the poverty line. They're still accessing income assistance, and I think, well, this has not been done in developed countries, but this has been done in developing countries with low-income individuals, not homeless individuals, but low-income. So what they did, this is like coming from Africa and South America and Southeast Asia as well. They basically take the cash transfer, which is, I think, equivalent to a few months' pay, right? So that's the amount of the cash transfer. They spend it on their farm, they spend it on their houses, they changed the roof, they got more furniture, they acquired some capital to grow their farm, like purchased cattle, purchased seeds, etc. So in that sense, and this is a one-time transfer as opposed to the regular payments.
Right.
So in that sense, I would say in a developed nation, if you're still living below the poverty line and you got the cash transfer, my guess is that you might move maybe to a different housing scenario, or you might get a car, so a lot of our single mothers who have kids, who have very young children, they put their kids to daycare right away because now they're able to afford it. So I think that's my prediction of how they were going to spend the money. But again, $7,500 in Vancouver is not that much. I think it's not enough to sustain their rent over 1 year. It's still a very modest amount. But
you mentioned that the state social assistance is $700 per month, right? So how much do you think that should be increased, to make a difference in the people's, ability to cope with their situation, or to at least have some bandwidth to make changes?
What's the minimum?
And we have
what was the minimum payment?
Well, we have 700 from the state, and then we have 7,500 from the cash transfer. So, and some people said that they prefer the cash transfer to be given out in different, in trenches, right? So so what would I guess the question is there any value in giving a big sum of money,
right,
versus a small sum and a regular sum?
Right. So there's a study done by Gift directly in Kenya that tested this idea. They either did a one-time lump sum transfer or 12 months, like monthly payments, much smaller payments. And the smaller payments increased, I think, subjective well-being and food security, but it didn't improve other things in people's lives. These are low-income villagers in Kenya. The one-time cash transfer, improves their assets, the durable assets. They invested more on their farm. They're able to actually, purchase goods and machinery on their farm. So I think there are different spending behaviors depending on the frequency of transfers and the amount of transfers. But back to your earlier question about, how much should the monthly payment be? There's no right answer, but the COVID-19 pandemic has given us an answer, because the Canadian government has given out $2,000 a month for 4 months to individuals who lost their jobs under the pandemic.
Okay.
So they think, so their argument is $2,000 is enough. At least enough in Canada nationwide to help you get back on your feet on a monthly basis for up to 4 months. So I still think that's not enough, but that will be a one benchmark.
So if in the developing countries people are investing in cattle and machinery, then what do we expect that people should be investing in developed country, like, for example, our homeless people or the low income people, right? What would we expect to be, like important expenditure that should be seen as a form of investment rather than, like overspending, excessive spending? You mentioned the durable goods, right? So would you elaborate how you think about the durable goods?
Oh yeah. So in the context of Canada, durable goods will be what? Furniture, cars, cell phones, computers, things that you would need to just have basic connections and do things, apply for jobs, right? Travel. I think mobility is huge. I mean, public transit is great in Vancouver, but not great in other cities in North America. So I think, yeah, I would see that, you know, if a used car in Vancouver is what, $2,000 to $3,000, like a very kind of, you know, very used old car. So you can buy that, and then gas is, you know, expensive, but it's still, you can travel now, right? And I think that's mobility is really important in especially for employment um, here. So yeah, so I think that will be my prediction of kind of investment after getting the cash transfer.
Okay.
Yeah.
Okay, to the audience, I hope that we have answered most of the questions that you have posted. If you have any questions that you would like to ask directly, I would invite you to turn on your video and you know, and just share your views or ask Professor Zhao, you know, questions about the study directly.
I see someone has had the hand up for a long time.
Oh, really?
Yeah. Mose
Yana? Yeah. Muzayana, would you like to, is this a real hands up? Would you like to ask a question directly? Or any others? Jingzhou, I see you are actively participating in the pigeonhole. Any other questions that we may have, you know, not answered yet? Okay, I guess people are feeling good. Yeah, okay, so perhaps let me just round up. Okay, the answer is has been answered. Yeah, a question has been answered. So okay, let me just round up by saying that of course we do not expect to always see sustained results from any interventions, and the reason is that if it's a mechanical problem, right, like if you're short of money and I give you some money, the money only lasts as long, you know, that period, and after that of course you will encounter financial problems again, especially if you have difficulty securing a proper job, or if your jobs are consistently low wages. So these are barriers or difficulties that cannot be solved with a one-time cash transfer. But what we have seen today is a very encouraging set of findings that at least, you know, people are not spending their money on temptation goods, okay, which is what many of us would have a lot of concern about. We also do not see evidence that people will just get off employment and, you know, and just have a holiday somewhere with the money. So they did not, there was no evidence of misuse of funds, which is very encouraging. Yeah, and that is, so for the Singapore audience, if you recall, we did have a comparable intervention some years ago of comparable magnitude, which is the debt relief program from MWS. So in that trial, they gave $5,000 of money, $5,000 to offset people's debts. Okay, so it's quite different from giving direct cash to people, but at least it reduced debt by $5,000. So we have the capability in Singapore to do something like that. Okay, so if you are interested in this, please let us know. Okay, I see Steffi who have a question. So Steffi.
Yeah, hi. Thank you so much for your presentation and sharing your results. So I have maybe two questions. So one is so in Singapore we recently did a study on the impact of COVID-19 on low-income families, and we found that one of our concerns was the cumulative impact of the pandemic, right? Which, and a lot of low-income families suffer from multiple dimensions of insecurity, of which housing security is only one dimension. So I'm just wondering, for your expanded study, right? I mean, what is the impact been in Canada on homelessness and poverty from the pandemic? And how will you factor this into your expanded study going forward? That's one question. The second question is more about RCT. So when I read about RCT, there are some, I guess, questions about the moral quandaries that RCT studies raise about how, I mean, generally we kind of understand that money improves the well-being of the poor. And then you're put in a situation where you have to give to some and not to others. So how do you, as a researcher and someone who's concerned about the well-being of poor and homeless persons, come to grips with RCT as a research methodology? Yeah, so those are my two questions. Yeah.
Great questions, Stephanie. Let me quickly just show this slide again. So this study they assess the impact of COVID-19 on individuals experiencing homelessness in Canada. The risks were much higher than an average person in an urban setting because of lack of, the closure of regular services, the lack of safe housing, and pre-existing health conditions. So going forward for our expansion project, which probably will come into life next year, not this year, I don't think, I think the services we will have to, I hope in a year's time the services will reopen. We obviously can't provide those services ourselves, but we will try to maximize the access of our participants to these services. So this is what we designed to have here at the end. Here we're gonna, so on the phone, free phone and phone plan, we're gonna provide to participants. They're gonna be a resource app. It's gonna be basically an app, depending on your location, we were gonna recommend services and supports around you right away. So that's our attempt at getting them to access their local resources. So that's kind of our plan going forward with the pandemic in mind. In your second question about the RCT, I think that's a great question because that's the single question that a lot of people who are mindful of the ethical implications for the control participants ask. They said, well, what about people in your control conditions that later found out they did not get the cash transfer? So we did a full debriefing with all of our participants at the end of the study, which was last year when we wrapped up the entire study. We debriefed every single control participants that we can still reach. And we told them about the scope of the project, what the interventions were. And we also thanked them for their contribution to this project and to provide scientific data to us. So none of the participants became upset or angry. They were actually really glad that they were involved in this research project. And 100% of our participants remained in contact with us even after the completion of the project. So they said, yeah, please keep me posted if you have further studies coming up or resources available. So that speaks to just their generosity with their time and their kind of willingness to engage in the research project overall. We did preface at the very beginning when we recruited every single participant that this is a randomized control trial, which means you'll be randomly assigned to one of these conditions. We did not tell them what the conditions were. We just say in some conditions, people will receive a cash transfer. Some participants, people will receive coaching or workshop, etc. So they going into the study, they weren't fully aware of the full scope, but at the end, they became fully aware. And so our plans going forward, again, with the expansion project, we're going to do an RCT again. But if we can fundraise enough money, we're going to give the cash transfer to our control participants first. Now, this does not, I mean, We do not plan to follow them up. This is just simply like an ethical gesture. Now, at the conclusion of the study, you should get the same treatment. And that's still our plan, and pending on funding. Yeah. Does that answer your RCT question?
Yeah, yeah. I mean, I just wanted to know how you manage those ethical kind of dilemmas. So thank you so much for explaining all that. Yeah. Thank you. Yeah.
Thank you, Steffi, for the question, and thank you, Jiaying, for the very wonderful sharing. I think RCT is always difficult, especially for people who are in direct services. You know, how do you explain to some people that, for the sake of understanding the efficacy of this program, or to convince the funders that to do this continuously, we need to first allocate some people to the program and others not. Yeah, it's really difficult. Okay, so I think we can let Professor Zhao have a bit of rest. You know, she has been talking nonstop for more than an hour. So over to you, Cleona, for some. And okay, let us just thank her. Okay, wonderful for her presentation. Yeah, thank you so much.
You're
Yes,
welcome.
thank you
Thanks
so
for having me.
much.
Thanks for the great questions.
Yeah.
We had one more thing to do, the second poll. Should I launch
That's
it now?
right. We have to do a second poll.
Okay, so I'll launch it now.
Yeah, okay. So for those of you who have stayed behind, if you could help us to answer the following question. If there were a trial in Singapore, how much do you think should be given to people who are homeless as a one-time financial assistance? Okay.
Of course, they're heavily biased.
Yeah. We have already anchored them with the first question. I mean, personally, I still find it fascinating that, yeah, I mean, $7,000 can only last for 6 months. And I mean, but when I think about it, it is true, you know, like if you have to pay rents, you have to pay for food, you have to pay for your children, how can you survive more than 6 months with $7,000? Yeah.
I see Stephanie has another question.
Oh, Steffi.
I'm so sorry. Can I ask one more question, please?
Sure. Please go ahead.
Yeah. So this is, I guess, maybe more from an advocacy perspective, right? So I see that you kind of take into consideration the general public's opinions of homeless persons and their spending on temptation goods, right? So I'm just wondering, is this strategic? Do you feel that it is important that the general public changes their prejudicial attitudes towards homeless people before policy can change? Because I guess I'm trying to kind of understand why, when it comes to opinions about the poor, that matters so much. Because we don't do polls about how people feel about how much hedge fund managers earn before we change policies related to those things. But when it comes to poor people or unpopular policies, say, for example, about immigration or migrant workers, there seems to be this tendency to want to kind of match public opinion to policy change. So I'm just wondering why you think that's necessary, and is it because otherwise it's very hard to get buy-in from policymakers? And and in a broader sense, what can we do about that, right? Do we always have to rely on public opinion to change before we do what we feel is right or just for society?
Yeah, that's a great question. I think policies change for many reasons. Public opinion is one factor. Lobbyists, that's another question. That's another factor. I think there are several, you know, lobby groups in Canada that are like advocating for UBI, advocating for more kind of cash-based assistance to the federal government at this point. And they are driven by public opinions. They are driven by other interest groups. So I think public opinion matters to a certain extent. They're not the concluding factor. And I think we need to work with the policymakers to you know, just basically ask them, what do you need for you to change your mind on this? What do you need to see so that we can change the policy, right? So that's a difficult conversation. And sometimes I don't feel equipped to talk to policymakers about this other than just showing them the evidence. I think they are, you know, you do have to kind of consider how policies are made in certain jurisdictions, like at the provincial level or the federal level. Yeah, so I don't have a good answer for that, but I do think like lobbyist groups driven by activists as well as public opinions do matter here.
Let's take a look at our polling results. I think we did manage to shift some people's opinion. So, well, I recall there were 30% of people who were unsure about giving $5,400 to homeless people as a one-time cash transfer. Now we have 24% who are willing to give 1,000 to 4,000. Okay, so that suggests that, you know, like at least some of you who have stayed behind are a little bit more convinced that this may make a real difference and is a worthwhile kind of intervention. Okay, so thank you so much for your views. We will keep this in mind for future studies. I just want to also pay attention to Adam Tan, who just wrote something on the chat that obviously financial assistance needs to come with housing support, counseling, financial advice, and a host of other support services. I think all of us agree, at least the four of us on the screen. We definitely agree that these are very important. I mean, other services are equally important apart from just cash, right? I think Prof. Zhao has mentioned that money can only solve certain kinds of issues, like like for example, if you need to pay for housing, that's what money can solve, but money cannot solve things like getting a job, you know, or fixing your problems at home. Okay, so all other services will be equally important. Okay, so yeah, I guess people still have some views to share. We don't have time, so I think we will stop here today. We will try to share any kind of documents that we have about the study on our SSR Facebook page, so that, you know, if you are interested to find out more or reread some of the results that are shown today, you may do so. Okay, so we'll try to do that. Look out for our Facebook page.
Yeah, and just to add also, our webinars are recorded. They're live streamed and posted on Facebook, so you can actually view our previous webinars, including this one, in the video folder of our Facebook page. And also one more thing is our next seminar in March will be on 30th March, and you can sign up here. There's a QR code, and there's also a tiny URL link. So it's tinyurl.com. This is our MAR web. And yeah, you can sign up there to look forward to our co-director, Prof. Irene Ang, will be the main speaker and moderator for that session. And you can look forward to hearing about digital inclusion then.
Yeah, so after housing, well, there are many things that they need. So digital access is the next one on the line. Okay, so do join us for our next webinar if you are available. Okay, thank you so much to Professor Jiaying Zhao again for sharing with us her fabulous project and findings, and to your active participation. I hope we left you more ideas and new ideas, and we hope to see someone take up the challenge to try this out in Singapore. Okay, so thank you everyone. Have a great day.
Jian, that was great. Is there any way to get a copy of the questions from the what is it
Pigeonhole?
called?
The pigeonhole, right?
Pigeonhole, yeah.
Yeah, I think Fiona will be able to do that.
Yep, I can give that to you.
Yeah. And yeah, which you know, like I'm not sure if the report will be ready for sharing yet, but if
It's not. In a few months, we will.
Yeah,
we're still writing.
Yeah. Okay, then we'll wait till then. I mean, the webinar will be put up online so people can refer to it for now. The recording is on our Facebook page. So yeah, so look out for it. SSR Facebook page. Yeah, somebody is asking me the question about the recording. Okay, thank you so much, Jiaying.
Thank you.
I hope you had a bite, like you managed to get dinner.
Oh, I have not, but it's okay. I don't eat dinner anyway.
Wow. But wow, powerful energy. Okay, so we'll catch up again.
Yep.
Yeah, okay.
Nice meeting you.
Right. Thanks,
Thank you.
Leona. Thank you.
Yeah, no worries.
Thank you.
Bye-bye.
Bye-bye.